femoral delay, if any. Okay, I'm going to check. First, can you look up and can you look down? Thank you. Can you open your mouth, please? Put your tongue on up. Kiss for central cyanosis. Thank you. Checking the carotid pulse. And I'm going to push a little in your tummy to check hepatojugular reflex. Thank you. I'm going to check, palpate the apical area, precordial, and the other one. Going to check the apex beat, auscultate 4 areas of heart. Can you please sit, can you please look that way? Thank you. Checking for any mitral murmur. Okay. And also checking the carotid with the bell. Can you please sit up? Okay. Leaning forward. I'm checking the bases of the lungs. Thank you. Can you please lay down? Exposing the legs up to the shin, checking peripheral edema and
Mhm.
the distal pulses.
Mhm.
Thank you for cooperation. Okay, done.
Done. Okay, doctor, have you took the permission for removing patient shirt, taking off the shirt?
I thought that in the starting consent. Okay,
No,
then I will ask
you
him
have to
again.
you have to
Okay,
take it. Okay. First, second thing,
okay,
when you are taking the consent, second, third thing, you have to inspection. Start from the inspection
yes,
and followed by the other things. Okay, inspecting even the back also, front also. When you're going to check that bibasal crepitations, you haven't done that one. Okay, so you have to tell the patient to sit
okay,
up and you have to check bibasal
yes,
crepitations. Okay, and
yes,
tell the patient. Okay, you have to see the behind scars also, any marking, any scars also. If you're not doing that one, again, it will be missed point
yes,
in the examination. Okay, so
okay.
just do the practice at home frequently. Okay, so next,
Okay.
Dr. Mavish.
Yes, Dr. Ma'am.
Okay,
Blood,
start.
Okay.
blood group.
Um, okay, Mr. XYZ, I'm going to check your blood pressure, okay, and then I'm checking your pulse on the both sides, and I'll bring the both hands on my eye level, and I check the for any clubbing or for any nicotine marks, and I'll check the radial delay at the same time. Then I will check his temperature, and I will look at the eyes for jaundice and pallor. Please look up and please look down. Then I'll be checking for any lumps and bumps in your neck. I'm going to press you. If you feel any pain, please let me know. Okay. Okay, Mr. XYZ, can you just remove your shirt so that I can have a look at your chest? Okay, thank you. Now he'll be removing his chest, and I'll look from the front and from the back, and then I'll ask the patient to lie down on the couch and keep the pillow beneath his head to make an angle, and then I'll bend down at the level of his chest to see for any thrill or any other abnormal movement, and then I will touch your chest. If you feel any pain, please let me know. I'll touch all the 4 areas of the heart with my palm. I'll check the thrill with my ulnar border of my hand, and then I'll check the apex beat, and then I'll be auscultating all the areas with the bell. And when I reach the apex beat, I'll ask the patient, please turn to that side and hold your breath in, and I'll be checking the apex beat. At the same time, I'll have a hand at the carotids, and I'll check the pulse side by side, and then I'll check the carotid with the bell, and then I'll ask the patient to sit forward, and I'll check with the bell, and I'll ask the patient to breathe out, and we'll check for any aortic regurgitation murmur. And at the same time, from the back, I'll check the bases of the lungs, and I'll then ask the patient to please lie down. And going to the foot end, I'll check the pedal edema on both sides and the peripheral pulses, and then I'll just thank the patient.
Okay, Dr.
And
Mavish.
how can
That's it, doctor. Okay,
uh
so
yeah.
doctor, first of all, taking the proper consent is in a way you have to verbalize starting from now onwards that Mr. XYZ, may I examine you?
Mm-hmm.
Okay, not if
Okay.
like say you are saying this way now, so it will be
Hmm.
keep on getting in onto your nerves in the exam. Okay, so
Okay.
you have to, in a requested manner, you have to take the consent. Okay, you are not going to order the patient. Okay, yes.
All
Second
right.
thing, yes. Second thing, when you are doing the examination, you should make sure that your patient should not be up, down, up, down. No, start from one end and finish on other end. Okay, like say bibasal crepitation should be on at the end of the examination, because we are going to make the patient upright position. Okay, for example, in
Okay.
the scenario, patient there is no pillow. Okay, that is the command. Now,
Okay.
patient don't have the pillow. What you will do?
Um, if the head end of the couch cannot be raised, then I'll just ask the patient to put his hands beneath his
No,
head.
no. In exam. For example, couch
Yeah.
also not adjustable. What will happen? Okay, now
Mm,
you are going to assume
okay.
it. As Dr. Ghulam
Okay.
Nabi was saying that other day that if 45 degree, so you should tell that I'm going to raise you 45 degree. You are not going to perform
Okay.
over there. You are going to tell the
Right.
patient that you are going to do it. Okay. So
Mm-hmm.
it's okay. There is no such thing, but proper consent is mandatory. Because if you are doing
Okay.
examination, full examination, but not taking the proper consent, again, it will be in be negative thinking. Okay, because you didn't took the consent and started touching the patient without asking and without taking proper consent. Consent is the main key of patient's whole scenario. Okay, Dr.
ठीक
Nadia.
है.
Hello, Mr. Hamad. I would like to do your cardiovascular examination if you allow me. Can you
Sure,
take off
doctor.
your shirt as well? And can you
Sure,
come to
doctor.
the couch, please?
Mm. Okay, doctor.
Okay. I will, first of all, I will inspect you, all right? A general physical. I'll check your pulse. I'll check your blood pressure. I will also check your hands for any clubbing, sphincter hemorrhages, and I'll check your capillary refill. I'll check your radial pulse and I'll compare your radial pulse in both the hands and the radial pulse with the femoral pulse as well. I'll look at the conjunctiva for any anemia and
Mhm.
any signs for hyperlipidemia. Okay, can you open your mouth? I'll check your oral cavity for any central cyanosis. I will also check for your JVP and carotid pulse. If you can kindly move your head on the left side, elevated 45 degrees. And I'll check your for any for hepatojugular reflex. Okay.
Mhm.
And I'll check your chest now I'll palpate the pericardial areas and
Mhm.
for any heave or any thrust. Okay, and I'll start checking, auscultate all the four areas, the tricuspid with the diaphragm, the pulmonic area, and the aortic area with the diaphragm, and mitral area with the bell of the diaphragm. Please kindly, if you can, lean forward for me so that I can check at the left lower sternal for any aortic regurgitation murmur. And now I'll check your back, inspect your back for any signs of scars or any abnormality, and I'll check, auscultate your back for basal crepitations. Can you
Okay.
please kindly just lay flat so I'll check the pulsations on your feet for dorsalis
Mhm.
pedis and tibialis posterior tibia, tibial artery as well.
Mhm. Okay.
Thank you.
Thank you. Okay. One thing is good that all three of you finished within the time frame. That is quite, reassuring that at least you are taking care of the time. Okay, so if like say you are keep on continuing the person with the within the time frame, so it will be easy for you to run to the management and safety netting. Okay, many of our friends, they run out of the time. The reason because they were making patient to sit, lie down, sit, stand like this. No, so whatever the examination is there, so you have to see where patient is sitting. For example, if you guys are comfortable doing the general physical examination, do the general physical examination on the car on the chair, then take the patient to the couch. Okay, so it will be more easy while sitting if you can do it. Okay, this is my practice. I'm telling you. Anyone want to follow, they can follow it. Okay, then you can do the examination or for the remove the shirt and do the examination over there. in the cardiovascular examination, abdominal examination everywhere. But don't forget to do general physical examination. If you are doing systemic examination, but you are not doing any cardiovascular examination, oh, sorry, general physical examination, so definitely you will lose the case, not you will lose the station. Sorry. Okay, so yeah, Dr. Mosma.
Yes, sir.
Excuse me,
Yes,
sir.
doctor.
Yes, doctor.
Sir, this new stethoscope of Littman 3,
Hmm.
their diaphragm works both as the diaphragm as well as bell.
Okay. Okay.
And
This is
and the
one of the
other
most
end
commonest question. Sorry,
and
let
the
continue,
other end is
continue.
the Pete's side.
Yeah. Dr. Sarfraz, first of all, let me tell you, there is no such need of that you have to buy expensive watches and stethoscope. If you have a simple stethoscope, you can take. If you don't have stethoscope also, they have stethoscope, they will provide you. Okay, doctor? So that I have asked over there, and one of our colleague, they didn't have this stethoscope they given. Okay, and I didn't have the watch. If you don't have the watch, you have to assume your wrist, you are taking wrist and just counting. There's no such thing. They are going to see that how many seconds you did this examination for this one. Okay, so no worry.
Okay, okay. No, no. If already I have, then we can
Yeah,
say that.
so for cardio, definitely you have to use the diaphragm and bell as per the video as shown you. If I haven't seen you, so you have to see. Okay, if you are using simply diaphragm and you are not using the bell area, so definitely they will be deducting your marks because you don't know the importance of diaphragm and the bell area. Okay, and one of our colleague, he had only the stethoscope which were having only which were what you call it one side. There was no bell side. Okay, so it is pretty fine. So they are not going to see as long as your method is correct. No one is going to say anything, doctor.
Okay, sir. Thank you.
Okay, Dr. Muazzama.
Yes, Dr. Imran.
Okay, start.
Okay. Now I want to examine you, Mr. Ali. Can I?
Yes, doctor. Go ahead.
Okay. First, I will sanitize my hand, and in the presence of complete privacy, I will examine you. First, I'm checking your pulse and looking at your hands of both sides and examining the both sides of the pulses. Okay. Uh, 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 then I'm palpating the lymph nodes from the front and the back also. Okay. Uh, Now would you please lie down on the couch so I can examine you? Would you please take off your shirt?
Okay,
Okay.
doctor.
Now I'm examining. Yeah. Now I am examining the chest. First looking at the chest, then I am pressing it mildly. If you have any pain, please tell me. Now I am now I am auscultating the four areas of the heart from the front side and from the first the mitral, all the four areas. Okay. Then would you please turn your head on the left side, and I'm looking at the and the patient is at 45 angle. Okay. Now I'm mildly pressing at the tummy to see any to see the reflex. Okay. Now I'm also palpating the both lower legs for edema. Now would you please sit down and keep your both hands on your shoulders, and I am auscultating the both and I'm auscultating two sides from the back. Okay.
Mhm.
Okay. Thank you.
Okay. Okay, doctor, let me perform for you
Yes.
guys. Okay, in one way.
Yes.
Okay, Mr. Kamal, Dr. Imran, I'm going to examine you. I'm starting for just examination, not taking history. Okay, Mr. Kamal,
Okay.
please be comfortable. If you during the examination, if you feel discomfort or any pain, please let me know. Do you have any neck pain or any pain in the body? No, thank you, Mr. Kamal. Can I see your hands? So show the hands in a straight away, and you look at the angle. If you can look nearby, or you can go a little bit far away. And Mr. Kamal, can I see your palms? Okay, so see the palm for any dryness or wet, for hypo or hypothyroidism. Check the pulses. While checking the pulses, you have to verbalize, Mr. Kamal, I'm checking your pulse, blood pressure, heart rate, respiratory rate, saturation, and weight according to your height. Okay, Mr. Kamal, thank you very much. Mr. Kamal, please have a seat, lie down. Okay. Before that, I have to take the that. Are you able to remove the shirt? Okay. If he say no, then okay, I will help you. So you have to tell this way. Okay, Mr. Kamal, be comfortable. Take this pillow under your neck. Are you comfortable, Mr. Kamal? Okay, thank you. So turn the head and see over the chest. Around the chest, you have to inspect the patient. You have to look. While doing this chest examination, you have to look into patient's eyes and open the mouth. Either way, either you can do on the chair, either you can lie down the patient and you can do it over there, okay? And you have to check patient's lymph nodes, lumps and bumps, whatever, so on. You can do it. And followed by, you have to see now, you are going to uh, you're going to check the patient's windpipe. You're going to tell not trachea. You say I'm going to check your windpipe. You have to you have to check. Okay, centralize, and after that see the second intercostal space. Okay, and count and put one hand on your on the patient's nipple, down the nipple area. It will be fifth intercostal space. Now I'm going to count 2, 3, 4, 5. Okay, just you have to assume that you checked your apex speed, and same time follow by come back on check the heaves, parasternal heaves. Okay, this is done. So Mr. Kamal, I'm going to listen your heart. Is it okay? Are you comfortable? You have to ask in between, so it will be more patient-centered thing. So now, Mr. Kamal, I'm going to see. So you have to see the 4 areas of the heart, and same time you have to tell the patient to tilt to check. Okay, if you are doing all the thing and after that you are telling the patient to tilt, no. Now here everyone have to listen that I'm going to listen your tummy artery, tummy blood pipes. Okay, you're going to see the aorta and renal arteries. Okay, while auscultating you are going to check this one also. Okay, and in your JVP you are going to do it. That is normal part. Once you have done, go to the femoral pulses, go down to pedal edema, check the web areas. The patient is a diabetic and whatever, so on. Check the web areas and check the temperature, pulse, and any edema, and come up and tell the patient, Mr. Kamal, can you sit up for me? Okay, thank you. Go with back and see the scars. Any scars, any operation marks are there, any rashes are there, whatever, so on. If you are missing this point, that you are not going to, if you are not inspecting the back of the chest and just putting your stethoscope for biobasal crepitations, so it will be negative impact again. Okay, many time there is agenda how closely you are doing that examination, and by check the biobasal crepitation. Thank you, Mr. Kamal. May I help you to take the shirt, take the shirt up? Thank you very much. Please have a seat. That's it, doctor. Okay, few things you can do as per your practice. Again, I'm telling you guys, there is no such that fixed thing that you have to do it, you have to follow the protocol. No, do as per the rules, but as in your own style. So own style will make you more comfortable rather than adopting some style which is more difficult. And now time is not that much that you have to focus on that part. Okay, I'm going to do. Going to take this X doctor, Y Z doctor, Z doctors, or Doctor Imran's style. No, definitely no. There is something that you have to apply your own style, so it will be more comfortable for you. You're getting me, doctors? So, Doctor Jaya.
Sir, I'm on work today. Sorry for today.
Dr. Jaya is not a doctor. I think I saw Dr. Nimra was there. Dr. Nimra?
Assalamu alaikum.
Welcome, Salam, Dr. Start.
Okay. May I examine you? Hello.
Yes,
May I
doctor.
examine you? I will ask you to the patient consent. I will first lyse my hands with the alcohol. Then please come. I will check. I'm checking the pulse. I will take his hand and then check the hands for any sweating, any tremors, and I palpate the pulse, radial pulse, and I verbalize that I am going to check your blood pressure, your respiratory rate, temperature, and oxygen saturation. Okay, Mr. XYZ, can you please come on the couch so I can examine your, I can examine you. Okay. And I will also look. Please, I will look at his eyes for any jaundice, any pallor. Please open your mouth. I will see his. Look at his tongue. Please protrude your tongue and take this. Take a sip of. Please do swallow. Can you swallow? I will just take any neck gland, and then please come on the couch. Please lie down if you are comfortable. If you have any pain, please let me know. Okay, okay, Mr.
Okay,
XYZ.
okay.
Okay, okay. May I proceed? And
Yes,
then I
doctor.
will. Okay, I will check. I will locate the windpipe in the center. Then I will come locate the intercostal spaces, second, and then fourth, and then I palpate the apex beat. After that, I simply palpate the peristernal heave. May I now I'm going to listen your heart. Okay, are you comfortable? Then I will
Yeah,
listen
doctor.
okay. Then I will listen the four areas of the heart, apex beat, and all the other areas. And meanwhile, I also auscultate the can you turn your neck to the other side, and then I will also auscultate the carotid broi on the both sides. Okay, and then I will listen to the apex for lungs apex. And please turn your please sit and then turn. I will look at the back of the patient, and if there is any rash, any redness or swelling, and then I will listen to the back of the chest. Okay, and then I will uh, check any pedal edema if present, and then look at the feet and thank the patient, and I will again sterilize my hands.
Okay,
Thank you.
Dr. Nimra, just go with more faster way, but don't go too slow and don't imitate. In both way, you will be, going in a negative way. Huh? So doing the faster doesn't mean that you perform good. At least you have to keep the stethoscope over the patient chest at least for one breath in out. Okay,
Mhm.
if you are not waiting for the patient to expirate or inspirate, definitely you that examiner will think that you are imitating the patient. Okay, so one thing. Second thing, whenever you're performing the examination, you perform in a real style. So for everyone to keep more focus on such way that it should look like a real doing. Okay, at least you have to wait for one breath in out. Okay, one cycle of breath should be completed, then you have to take out a stethoscope. Don't put tuck 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 like this. No, this is also the negative point of getting a negative point while in examination failure. Okay, so please take care of it. Okay, Dr. Wasim is there.
Hello, yes, doctor, I'm here.
Yeah, Dr. Wasim, can you okay, now it's your turn, doctor.
Yes.
Okay, start, doctor.
Hello, Mr. Kamal. I am Dr. Wasim. Can I examine you? I
Sure,
will
doctor.
sanitize my hand. Take a general look. Look at the hands. Look at the nails, and look at the palms of the palm of your. And then I will check for pulse on both hand, radial pulse, and then I will compare the pulse of the loin, and I will check your eyes, Mr. Kamal. Is that okay for you? Can you
Mhm.
look up? Can you look down? And I will check for the neck for the GVP. Mr. Kamal, can you look on the other side? And I will make your position at 45 degrees. Is that okay for you? Mr. Kamal, I want to hear your pulse in the neck, in this carotid pulse with my stethoscope. Is that okay for you? I will check it on
Okay.
both sides. Mr. Kamal, can you remove your shirt? Is that okay for you? I want
Okay,
to check
doctor.
your chest. I will palpate the apex beat with my palm of the hand, and then by lateral side of the my palm, I will check for the peristernal heave. And Mr. Kamal, I will check now your heart sounds. I will listen to the all four areas of the heart. And can you hold your breath for a while? And can you move on the left side? Mr. Kamal, can you sit down for me? And I will check for the any scar on the back or any surgery marks on the back or front. and I will listen the breath sounds. I will listen for the basal cracks. And thank you for and yeah, I will palpate the tummy for the jugular pulse. And Mr. Kamal, if you have any pain, just tell me. I will stop then and there. And I will check for the pedal edema. And I will see the arteries in the legs, dorsal spadius and anterior tibial. And thank you for your cooperation, Mr. Kamal. You can wear your shirt and be comfortable. Thanks.
Okay, doctor. Doctor, have you checked this abdominal aorta and renal arteries?
No, doctor.
Please do focus on that one. That one also recommended for the cardiovascular examination. That is, yeah. In orientation program, I got negative marking. I was not preparing this thing. Okay, I was not auscultating. Okay, I got a negative marking over there. So please go ahead check properly. Okay, so that is as important as your GVP. Okay, Dr. Rani. Dr. Rani.
Sir, I'm on work right now.
Okay, Dr. Shahzad, are you going for exam? Dr. Shahzad. Dr. Ghulam Nabi.
Yes, doctor.
Yes, sir. Start.
What examination? Abdominal? Or what?
Cardiovascular examination.
Cardiovascular examination. Okay. Just a second. Okay. May I start?
Yes, doctor.
Okay. Hello, Mr. Just a second, Dr. Imran.
Okay,
what is
doctor.
the name? Any name I can tell the any name?
Any name.
Okay. 1, 2, 3, start. Hello,
Start.
Mr. Imran. I am Dr. Ghulam Nabi. I want to examine you with your. Are you comfortable?
Yes, doctor.
Then okay, I will do the alcohol massage on my head, and then first of all on the chair I will check the pulse, radial pulse, both at a time. Okay. Then I will see his hand on the level of his face. Okay. Any scar mark or any in the webs of the fingers also, and also nails also. Okay. Then I will look the eyes, say up, see the NA pillar, and see the down for the joints, any yellowness, and can you open the mouth? I will check the nose also. Can you protrude out your tongue? Thank you very much. If you, Mr. Imran, anything finding the pain, just let me know. Thank you very much. Okay. And can you come on the couch, please? Thank you very much. And can you remove the shirt? Thank you. Okay, I will look, listen, and palpate. I will touch your chest also. If you feel the pain, just let me know, Dr. Imran. Okay?
Sure, doctor.
So, I will see the inspection on the eye level on the bed, side by side, any scar, any swelling, any up-down movement is not equal of the chest. Okay, any scar mark in front of it. And then I will ask Dr. Ma, do you have any pain in the chest? Okay, I will palpate to the all
No,
6
doctor.
areas and the lateral sides of the chest also. And then I will start the 4 areas auscultation through my stethoscope. Okay, the first is mitral, then tricuspid, then pulmonary, then aortic area. Okay, then then I told them to can you sit down and little bit ahead, and I put my stethoscope in between the tricuspid and the pulmonary area for check the murmur. Okay, and when I tell you to hold the breath, kindly hold the breath. Thank you very much. Okay, now I'm going behind his chest, any scar mark or any swelling, and then I'll auscultate his lower area of the chest for the any crepitation for congestive heart failure. Okay, Then can you lie down, please? I will check his both legs for any swelling. Thank you very much.
Okay, doctor. Thank you. Okay, Dr. Ghulam Nabi. So
What I missed?
you didn't miss, but you start in a way that you have to first see the patient hands, inspect the hand, and then you touch the patient. Without inspecting, touching the patient is as equal crime as equal. You are not doing. You're missing any point.
Okay, okay, doctor.
Okay, doctor.
Thank you.
So, doctor, for everyone's refreshment, pitfalls of for failing in the exam or get losing the exam. So, I'll be telling you. Not focused on patient examination. Focus examination does not mean that superficial examination, but which focuses on eliciting the finding that helps to confirm or refute a possible diagnosis. This usually includes relevant elements of general examination and some system-specific examination tailored to the nature of compliant. Like say, assessing the bowel sound or shifting dullness is not going to be essential in a case focused on recent onset epigastric pain. Okay, this is example one. Number two, incomplete examination. Incomplete examination means like say involve both general physical examination as well as a focus relevant examination related to the differential diagnosis. For example, examining for the causes of breathlessness, candidates should look for the pedal edema in addition to auscultation of lung and heart. Simply for any thyroid condition, one needs to check reflexes in addition to examination of the thyroid. Okay. Third thing, doctor, ineffective exam technique. Just doctor, give me 1 minute, doctor.
Okay.
Okay. Second thing, doctor, ineffective exam technique. Let me give me doctor some example. Like say placing the stethoscope in different symmetrical sides on the chest to auscultate for a breath sounds, but consistently not leaving the stethoscope in one place long enough to hear inspiration or expiration as mentioned. Okay, palpating over the abdomen in random fashion, or performing the deep palpation out of habit, despite having elicited tenderness to superficial palpation. Not looking at the patient face while examination is another negative impact on examiner. Okay, testing for the reflexes at the site or with a technique which will not elicit a reflex response. Like say, if I wanted to do some reflexes which is not meant for that one and my technique is not correct, so it means I have done something wrong. Okay, so examiner is going to look for you. You are encouraged to consult a standard textbook on examination. For example, they are saying doctor to go for McLeod clinical examination, but there's no time for that one. Okay, to refine your technique and may use some sort of videos as I shown you the video. Please remember that a relevant focus examination is required in a general practice, and therefore in MRCGP International exam, good technique needs to be applied, demonstrated in a relevant focused manner. Okay. Okay. So, and second thing, overlooking a patient comfort. Ensure during any examination you stay watchful for any signs of pain from the patient. Example, like say facial expressions, grimaces, and if patient is and if it is unavoidable to cause some discomfort, where patient is getting discomfort, stop the examination. Okay, and expose the patient only as much as it is required. You should not say that okay, remove everything. No, it is required for the relevant examination to ensure they know when they are able to dress up again, allowing privacy for this wherever it is possible. Okay, so what should be done, doctor, in examination for everyone? First of all, in a 10-minute consultation, we have only 2 minutes for the examination. Okay, so what you're going to do is general assessment. Quickly look for any obvious clues like say clubbing or whatever so on. Does the patient look unwell? Are there any obvious physical signs at first glance? Physical signs record the important vital signs like the pulse, blood pressure, temperature, respiratory rate, or whatever, so on. And focus physical examination, adopt a focus and selective approach tailored to the findings from the history. Inspect, palpate, auscultate, and check the function of relevant body areas and system as appropriate. Okay, so doctor, these are the something that we have to understand. We do everything, but if we are not doing in a manner or fashion way, so it will be more difficult for you guys. So doctor, remaining
Dr.
doctors
Imran,
are yes, doctor.
I forget two things. One is
Yes, doctor.
JVP, second is
Yeah.
carotid bruit.
Mhm. Yes, doctor.
Carotid bruit. Yes, carotid bruit and JVP. I missed it.
Yes. And doctor, rest 9 doctors I will be taking in evening session. I will be arranging 135 or 40 minutes session in evening. So we'll be starting our revision program. So please go start as I mentioned, doctor.
Okay, doctor. When you will come back again?
No, I'm doing that revision plan.
Okay, okay.
Okay, in a revision plan that we had a topic. So doctor, as I mentioned that in earlier session, so doctors ready?
Yes, doctor. Yes,
Yes,
Dr.
doctor.
Imran.
Okay. Yes, doctor. So, who came first, doctor?
Dr. Imran, you were saying I will do the
Yeah,
first.
yeah, yeah. So you are the one. You are the one, doctor. You came first. Okay. So your patient is 45 years old, Mr. Hassan. Come to discuss his problem with you. Take proper history, examination, and management plan, doctor. Start.
Dr. Imran, just a second.
Okay, doctor.
Okay, patient name, sorry.
Okay, Mr.
Mr.
Hassan,
Ahmed.
45 years old gentleman, come to discuss this problem with you. Take proper history and examination and manage the patient, doctor. Start.
Okay, hello, good afternoon. I'm Dr. Musaya, today's GP in the clinic. Mr. Hassan, how may I help you today?
Doctor, I'm suffering from this pain last 8 hours, doctor.
Can you please tell me more about your condition?
Doctor, I have this pain right in the middle, upper part of my tummy, and going
Okay.
straight through to my back, doctor.
Okay. Since how long it started?
Doctor, it's been 8 hours now.
And can you please pinpoint your exactly the site?
Just, doctor, on my tummy and that stomach area, middle of my tummy, and going directly to the back.
Okay. And did it happen for the first time?
Yeah, doctor, this is first time for me.
Okay. And how much is the pain score if it's from 1 to 10?
Doctor, it's really 10 by 10. Doctor, I can't lie down, doctor.
Oh.
Please give me cows something, doctor, to please lie down.
Yeah. Okay. Are you comfortable if you lean forward? Does it make you
Uh,
relieve better?
no, doctor, it's no. I just feel that when I'm lying down, it's making me more difficult. Doctor, it's a
Okay.
short of breath now because I can't, doctor, tolerate, doctor, this pain. Do something, please.
I understand. Just few more things. I'm arranging as according to ABC protocol. I want to check you while you can you lay down on the couch,
Okay, sure,
like on the
doctor.
side in the fetal position, if
Okay,
that's
doctor.
okay with you.
Sure, doctor.
Okay. Did you take anything to relieve this pain?
Doctor, I tried this paracetamol tablet, but it is not helping me, doctor.
And anything you think that it's getting worse because of anything?
Doctor, when I'm lying flat, it make me just like say better. It's first thing actually. When I'm sitting slight upright position
Hmm.
and just forward, like say curling up as you mentioned
Okay.
just now, doctor, is feel better now.
Yeah. Yes. Okay. Can you tell me if you vomited also?
Yes, I do. I do vomited, doctor, 2 times, doctor, but it was nothing came up, doctor.
Okay, and what about, do you have fever?
No, doctor.
Apart from going to back, is it going somewhere else also?
No, doctor. This is only just like say someone keeping the knife from front to back.
Okay, so Mr. Hassan, just few more questions, and I am also activating my staff members to put IV line in your both hands, okay? And we'll be talking further since you are so much pain. I just want to know few more things. Do you have any long-standing illness?
Doctor, no, but let me tell you, doctor, this, you asked me that past one. 6 months ago, I had a similar pain, but it settled within 1 hour or 2 hours, doctor.
Okay, but it's so bad right now that you cannot even sit properly, right?
Yes, doctor.
And at that time, were you admitted in the hospital?
No, doctor. 2 years
Okay.
ago, I did ultrasound. They told me I have some stone in my gallbladder, and after that, I got this cholesterol problem. I'm taking this tablet for the cholesterol because my family history is there for high blood pressure and heart attack. So doctor started me this
Mm-hmm.
medication, and that's it, doctor.
May I know more, what kind of medication you are taking?
Doctor, I'm taking this atorvastatin 20 mg. Today I took
Mm-hmm.
this paracetamol tablet two
Mm.
times, doctor.
Okay, Mr. Hassan, in your family, anybody had a similar condition?
No, doctor.
Okay, so what do you do for a living?
Doctor, I'm a teacher.
And with whom you live at home?
I'm living with my family, doctor, my wife, my parents.
Yeah, someone came with you or you came alone?
No, doctor, I was in the school. Suddenly I got this pain. Now this is 2
Mm.
p.m. So that my friends they brought me here and they went already. I call my family member. They'll be there on the way, doctor.
Yeah, they will be there. Or in the, can I know is there, do you smoke, Mr. Hassan?
Yes, doctor, I do smoke. Doctor, this is my bad habit. I'm trying
Mm.
to quit, doctor.
Okay, we'll be talking about this in later session. And do you have a habit of alcohol also?
No, doctor, I used to take alcohol long ago, but it's been 10 years I
Mm.
haven't.
Okay. And when was your last weight according to height?
Doctor, my weight was BMI was actually doctor 23, but I think now I am getting losing the weight without anything, doctor.
Okay, okay. May I know, Mr. Hassan, do you have any idea about your own condition? What's going on?
I I'm thinking that it's maybe the indigestion because last night I had heavy food and maybe my
Mm.
gallstone coming up again, doctor.
Okay, we'll talk about this. And is there any particular concern you're worried about?
I'm worried that something seriously going wrong with me, and maybe I'm
Mm.
going to die, doctor, because it's painkiller. The pain is giving me a lot of trouble, doctor. Can you give me some
Okay.
painkiller, please?
Yeah, yeah, sure. I'm just going to give you a painkiller that is called pethidine. And meanwhile, I just want to know, apart from this painkiller, do you expect anything from me from
I need
today's
something to
consultation?
stop this pain and find out what's
Yeah.
causing it, and I want to go back to home because today my daughter's birthday.
Okay, okay. So, and let me sum up. Mr. Hassan, you are having this condition since 8 hours, severe pain in your tummy, and you have history of that gallstones, and you are taking a torvastatin for that. And you want to go earlier, just you want a medication for the pain relief. Is that all?
Yes, doctor.
Hello,
Yes, doctor.
hello,
Yes, doctor. Hello, hello, hello,
hello.
Dr.
hello, hello.
Imran, you
Yeah,
are
Dr.
yeah,
audible.
Imran, can you hear me?
yeah. I can hear you, doctor. I can hear you,
Hello.
doctor. Yes, I can hear you, doctor.
Yeah.
Hello. Yeah.
Okay, okay. So I just want to quickly examine you in the presence of chaperone. Is that okay with you?
Sure, doctor.
According to ABC protocol, I want to check your first general physical examination, BP, pulse, temperature, oxygen saturation, respiratory rate, and also airway, breathing, circulation. I want to check eyes for any anemia, oral mucosa of any cyanosis, lumps and bumps, and also I'm going to palpate your tummy. Meanwhile,
Okay.
is there any tenderness present, pain present? Please let me know. And I'm also checking the apex beat.
Okay, doctor. Examination shows um appear acutely unwell, lying still in severe pain, temperature 38.1, heart rate is 112, blood pressure is low 90 by 60, saturation 22, saturation 96, abdomen dry, upper abdominal tenderness, especially epigastric and left upper quadrant, gardening but no frank rigidity, bowel sounds reduced. Okay, no obvious Murphy
Okay.
sound signs and no marked
Mm,
lower abdominal tenderness, no jaundice, no obvious
mm.
Cullen's and Gray Turner sign.
Okay, I'm going to run some blood investigations for you. Uh, I want to check your CBC, CRP, ESR, amylase, and lipase level, and also ultrasound of tummy.
Okay, full blood count shows WBC elevated, uroelectron showing hypokalemia, and
Hmm.
LFT is showing a cholestatic pattern, and raised CRP. Abdominal ultrasound shows gallstone, possibly that there is a dilated bile duct also. Rest of the examination normal.
Amylase and lipase level.
Pending.
Okay, so Mr. Hassan, actually, the condition you're going through, it's right now an emergency and it's called as acute pancreatitis. Do you have any idea about this?
No, doctor. What is this, doctor? Something dangerous going with me, doctor. I'm going to die.
No, actually not. It's not like that. It will, but still, if we need to admit you as soon as possible in the emergency department because this condition can be lethal if we don't treat it on time. Okay.
Oh, okay, okay, doctor.
Yeah, I know you're very concerned about going back to your boss party, but still, I need to admit you. We need to monitor you because it is not a condition I can leave you with. So, are you following me?
Yes, doctor. I am following you, doctor. So, doctor, I
Yeah,
can't go home. I cannot eat foods because I'm hungry, doctor. It's been lunchtime now, doctor. I
no,
can't be.
no. Let me tell you in detail what I'm going to do. Firstly, we already did IV lines, okay, in your blood channels. They will be giving you fluids, okay. I know you're hungry, but you cannot take anything from mouth,
So, what
okay.
they will do,
It will
doctor,
be,
with me?
and they will be admitting you and doing further more scans until your reports are confirmed. They will be starting your other medications in the hospital. And as soon
Okay,
as your
doctor.
pain is relieved and the specialist opinion will be given, after that we will know how to proceed further. But for now, I want you to get admitted in the emergency department.
Hmm.
Referring you with my staff. Okay.
Okay, doctor.
And meanwhile, please try
I
not
am
to
up.
take anything from.
Okay. You touched the safety netting, so you clear this one. First thing, you did ABC approach, which I like it, and it must be dealt with every emergency case. Okay, any patient come with a pain, so you have to go for it. But except your Socrates was upside down, rest of that was perfect. I don't have to say much. Uh, because many things patient have told, but still Socrates, you have to follow the protocol. Okay. So next we'll be moving to Dr. Manish.
Dr. Imran,
Yes, Dr.
without
Ghulam Nabi.
serum amylase and lipase, we can say acute pancreatitis
Yes, doctor, we can
on
say
the day.
because patient having gallbladder stone, gallstone history, and 6 months ago he had the same thing. Okay. Second thing, gallbladder, sorry, gallstone history patient always having acute pancreatitis. We read in our AKT exam, Dr. Ghulam Nabi, if you know
Complication.
that.
Yes, yes,
Yes,
I
doctor,
know,
past
I know.
medicine.
But I think the gold standard is the lipase
No,
becomes raised.
in this case scenario, that the trigger was sorry, that hidden agenda was to diagnose without
Uh,
amylase, because amylase is how you're going to deal with amylase here in emergency when patient is in acute pain, doctor.
No,
Okay,
no, we
so
will
amylase,
stabilize and we refer the person.
yeah, we are stabilizing. And
So
I'm suspecting that you have acute pancreatitis. So on examination, finding itself, patient got it, or doctor got it.
suspected.
Yes, doctor.
Suspected.
So
Okay,
yes,
suspected.
doctor. Yes, suspecting. Okay. So she told suspected. So,
Okay.
so it's been dealt. Okay. So Dr. Mavish.
Yes, Dr. Imran.
Okay, Dr. Mavish, your patient is your patient. No, no, they look like yeah, no, doctor, your patient. I have to give you this scenario before I give in. Okay, you are dealing with Mr. Tariq, 52 years old gentleman. Come to discuss his problem with you. Take proper history, examination, and management patient. Okay, start.
Hello, Mr. Tariq. My name is Dr. Mevish. How may I help you?
Well, doctor, yesterday I started feeling very sick and vomited few times. Today I vomited what looked like a coffee ground that's later turned into red blood, doctor.
All right, Mr. Tariq. Can you tell me more?
Doctor, let me tell you, I was been feeling that my stools are bit black and tarry. I was not
Mm-hmm.
noticing. Maybe I thought maybe I'm taking some sort of food which is making this color. But yesterday I was sick actually, and I vomited few
Okay.
times. And then I got this coffee ground color vomiting. Then now today morning it was just 1 hour ago. It was a really red blood from my vomit, doctor.
Oh, okay. That's very terrible to hear, Mr. Tariq. Can you tell me how much was the blood if you measure it in cups?
Doctor, I don't know. It was full spill on the ground.
Okay. And was it fresh blood?
Yeah, doctor, it was red blood, not fresh. It was looked
Okay.
like a red blood.
All right. Do you have any pain in your tummy, Mr. Tariq?
Doctor, I feel discomfort actually, and some heartburn in my tummy area.
Okay. Mr. Tariq, are you comfortable sitting in the chair or you want to use the couch?
Doctor, I'm okay, but I can if possible, can you give me this couch?
Yes, please lie down on the couch and I'll have the nurse to pass an IV cannula and check your blood pressure at the same time. All right?
Okay, doctor. So why IV cannula,
Okay.
doctor? To me, I'm all right. I'm sitting on the couch.
Yeah, in just in case I'll have to start you on anything. That is why.
Okay,
So
okay, doctor.
let me
Okay,
ask you
okay,
a few
doctor.
more questions, Mr. Tariq. Since when are you having those black tarry stools?
Doctor, it's been couple of days. Like say maybe like you can say by 10 days.
Okay, and how many times you pass stool in a day?
Doctor, daily I go twice.
All right, okay. And every time the color is black color of the stools?
Morning time it's like a terry black color. Then after that become terry.
All right. And the burning in your the tummy, does it start after meals?
Uh, no, doctor. It start morning time and in the middle of the night.
All right, okay. Mr. Tariq, do you have any other medical illness previously?
Doctor, I do have this joint pain. Been couple of years now, or I'm diagnosed with osteoarthritis.
All right, okay. So are you taking anything for that?
Yeah, doctor, I'm taking sometime I'm taking tablet ibuprofen. Then doctor gave me this atorikoxib, and
Okay,
there is one drug, doctor. I'm taking this calcium tablet also he given me.
all right. Mr. Tariq, how frequently you take these painkillers?
Well, doctor, I'm taking every day most of the time. Sometimes I'm taking twice a day.
Okay, okay. And does it help with the pain?
Doctor, a bit. It
All
is
right.
making me to move around. That's all, doctor.
Mhm. All right. Mr. Tariq, do you have any racing and pacing of your heart?
No, doctor.
Any, do you feel tired all the time?
No, doctor.
And have you noticed any sudden change in your weight?
Doctor, I lost only maybe 1 kilo weight.
Okay. All right. That's not much. So, Mr. Tariq, how's your diet in general?
I'm a foodie person, doctor. I like to eat and drink every time.
Okay. And do you know your current weight according to your height?
Doctor, my BMI is 27.
All right. So, do you have time for exercise?
No, doctor. Frankly speaking,
Mhm.
I'm a heavy alcohol drinking person. So most of the
All right.
time,
I
I
see.
knocked on myself on the back.
Okay. And do you smoke as well?
Yes, I do smoke.
Okay, how much?
Doctor, I'm taking these cigarettes, almost 20 cigarettes daily.
Okay, that's quite a lot, Mr. Tariq. So you see, smoking and alcohol, they are not good for your health. And if you want to quit them or you think about quitting them, please come to me and I can help you in that. All right?
Okay, doctor, can I vomit because I'm feeling vomiting, doctor?
Yeah, please, here's the bin. And
Okay,
yeah, please. Okay, so Mr.
vomiting
Tariq.
bright red color bird.
Okay, okay. I'll ask Anna to attach an IV fluid as well. Okay, Mr. Tariq, just let me be quick. And do you have any family illness? Family history of any illness?
No, doctor.
Okay. So what's crossing your mind, Mr. Tariq, right now?
Doctor, maybe I have some sort of gastritis because of my cold.
Okay, yes, it could be. And anything that's particularly worrying you right now?
Doctor, I don't want to go to hospital. Just give me some medication. I can go back home.
Okay, we'll see about that, Mr. Tariq. How did you come here?
Doctor, I came by taxi.
Okay, and what do you do for a living?
Doctor, I'm a shopkeeper.
All right. So, okay, so Mr. Tariq, let me sum up. You've told me that you had bright red vomiting, and coffee ground vomiting, like since yesterday, and now you have vomited as well. And you are been passing tarry-colored stools, and you don't want to go to hospital, right? You want to
Yes,
add
doctor.
anything?
No, doctor.
Okay, Mr. Tariq, can I examine you quickly?
Yes, doctor. What you want to examine, doctor?
Okay. I will start from the blood pressure on both sides and the pulse and the temperature, and I'll check for your eyes for jaundice and pallor, and any lumps and bumps in your neck. And Mr. Tariq, if you don't mind, in the presence of chevron, please remove your shirt. Is that okay with you? Because I'm
Hmm?
going to touch your tummy. Okay. If you feel any pain, please let me know. So I'll palpate lightly and then deeply, and then
Doctor.
I'll percuss it and auscultate it, and I'll end my examination with the digital rectal exam.
Okay, heart rate 110, blood pressure 90 by 60, respiratory saturation 96. Conjunctiva, pallor, cold peripheries, abdomen, mild epigastric tenderness, rectal examination showed melena.
Melina. All right. Mr. Tariq, I'll be maintaining your airway pressure, airway breathing and circulation right now. And from your history, I suspect that you are having, as you thought that you're having gastritis, but I think that you are having a active bleeding ulcer right now. All right. Or it could be
Oh,
because of your poor dietary habits and as well as the long-term the painkillers that you are taking. Do you understand?
okay, okay, doctor.
Okay.
So what
So
is the
I
problem
guess.
with you, doctor? Doctor, can you tell me again?
Yeah, you're having a bleeding peptic ulcer.
Okay, doctor.
Okay, and right now, since you're vomiting blood, so I need to send you immediately to the emergency for emergency treatment. All right.
Hmm.
I can understand that it's a scary situation for you right now, but it is the best for you. And I'm calling the ambulance. And if you want, I can call your family member as well. Okay.
Doctor, are you giving me
So
anything now?
yes, I'll be giving you. Passing as I have passed the IV cannula. I'll be attaching an IV fluid, and I'm giving you injection onset for your vomiting. Okay,
That's it,
and
doctor?
when you go to the hospital, they'll be giving you an PPI, and they will stop your blood, and then they might do an emergency endoscopic procedure to see from where the blood is coming from. Okay.
What is endoscopy, doctor?
They'll pass a camera in your food pipe to check for the source of bleeding. And if required, they might be doing some procedure there and then to stop the bleeding. All right?
Hmm. Okay, doctor.
Okay. So after you're stable and get discharged from there, Mr. Tariq, I would like to have another sitting with you where we can discuss about different lifestyle changes that you can adapt in order to improve your health. All right? Can you
Okay,
do
doctor.
that?
Okay, doctor. Okay, doctor.
Okay, so we'll be having a talk about how to quit your smoking and alcohol drinking habit, and on some changes in your diet as well.
Okay,
So, are you
doctor.
okay with that?
Okay,
Okay, so
doctor.
I'll be seeing you. The ambulance is here, and I'm transferring you along with my staff, and then I'll be after your discharge from there. And please,
Okay,
I'll
doctor.
request you to stop taking those painkillers too. All right.
Okay, doctor. Okay, doctor.
We can have a consultation with your joint specialist who can put you on other drugs that are safe for your stomach.
Okay, doctor.
Okay. Okay, and then
Okay,
I'll see
doctor.
you afterwards, Mr. Tariq.
Thank you,
Thank
doctor.
you.
Dr. Mavish, why you say peptic ulcer disease?
Because he was vomiting
Hmm.
blood, coffee
Hmm.
colored stools, and he has tarry stools, so he might be
Okay.
having an upper GI bleed.
Doctor, first of all, whenever we are saying any wording, so we have to bear the weight of those words, okay? In exam and even in the real life, I say, we have to say this one. I'm suspecting you have a significant upper GI bleed, not a peptic ulcer, okay? Peptic ulcer means like say you diagnose the patient,
Okay.
okay, from the
Hmm.
history, from your examination, which is not. Okay,
Okay.
bleed from can be anywhere. And
Hmm.
since Mr. Tarek, you are hemodynamically, like so your blood pressure is low, so I'm going to
Hmm.
start some fluid. So let me tell
Yeah.
you in this management outline, I'm suspecting upper GI bleed, okay? Rather than telling
Hmm.
that I'm going to, you have to sell the peptic ulcer or the gastric ulcer, whatever, so on, no, doctor. It will give
Okay.
you a negative impact. So we have to talk about a broad diagnosis. So at
Hmm.
least examiner should say that you are not a judgmental, huh? Second thing, you very well said that ABC, but you have to start the PPI, pantoprazole.
Okay. Okay.
Okay, you have to give the pantoprazole at this point. Okay, and by
Right.
to save the time, you can say to save the time, I'm going to run some investigation. Once you reach over the hospital, the investigations will be ready. So examiners will
Yeah, I
be
forgot the
helping that at least
investigation.
you have to you do it. Okay, in that one you can say
Yeah.
that I will be doing your blood grouping, cross match, full blood count.
Uh-huh.
Here cross match. Why it is mandatory? Because
Because he
this
might
patient
need
having
blood.
bleeding. Yes,
Yes.
exactly. Okay, and full blood count, urea electrolyte to know about any sorry, renal failure stuff and LFTs and coagulation profile.
Okay.
Okay, so this was the agenda of this case. Otherwise, your case is good, but management was bit upside down. So, an emergency case with upper GI bleed or any bleed,
Hmm.
please
Hmm.
use the word properly and don't tell the diagnosis in a way that you diagnose the patient with a peptic ulcer. Okay, so it will be a
Okay.
negative impact. No matter how good you do, examiner will take as a judgmental. Okay, so.
Okay.
Yes, doctor. Dr. Iram Yasir is there. Dr.
Yes,
Saira
doctor.
is there.
Yes,
Yeah,
doctor,
Dr.
I'm
Saira,
here.
Dr. Iram Yasir both. Okay, Dr. Saira. Oh, sorry, Iram, Dr. Iram, your case is
Yes,
one
doctor.
now with me. Uh, Mrs. Laila, 38 years old women with a 3 month history of some problem. Come to discuss her problem with you, take proper history and focus examination and management plan.
Dr. Mrs. Leila, what's the age?
38.
38. And what did you mention first?
He's having some problems, is 3 months.
3 months. Okay.
Yeah.
Okay. Anything else given?
No, doctor, that's it, doctor.
Okay.
Okay, doctor. Start.
Hello, Mrs. Laila. I'm Dr. Iram. How can I help you?
Well, doctor, I'm getting this problem, uh, some sort of pain in my center of my chest and my tummy. Really been trouble. It's been 3 months now, doctor.
So sorry to hear about this, Miss Laila. Please tell me more about your pain.
Doctor, I'm really tired of this one. And nighttime, I can't sleep because of this pain, doctor. And it is disturbing me a lot, doctor.
Okay, I can see that you are in a lot of trouble. I'll do my best to help you. Miss Leila, what does this pain looks like, feels like?
Doctor, it's like a burning pain in my center of my chest and my tummy also disturbing.
Okay, you tell it is in the center of the chest.
Yes,
And
doctor.
if I tell you to rate it on the scale of like severity from 0 to 10, 0 being minimal, what grade would you give it?
Let's say, doctor, 4 to 5, sometime night time.
Okay, and you tell me it's more in the night time. Does it increase from 4 to?
4 to 5, sometime when I'm taking heavy meals, like say most of the time.
Okay.
I like this new burger came in the town, so I like to take care of one. So I'm getting this
Okay,
problem
okay,
most often that time after this one, doctor.
okay. And does it pain goes anywhere?
No, doctor, this just stays over there.
Hmm. Do you think eating makes it worse or anything else makes it worse?
Doctor, eating make it worse, and sometimes worse when I'm lying flat or bending
Mm-hmm.
over.
Mm-hmm. Okay. And what makes it better? Have you figured out?
Yes, doctor, there's a one syrup my mother given me this some milk of magnesia kind of stuff.
Mm-hmm. Mm-hmm. Okay. Do you notice any heartburn also in the in the daytime along with
Yes,
this?
I do, and after that I take some milk and some cold thing,
Mm-hmm.
then it soothes me, doctor.
Mm-hmm. Do you feel bloated?
Couple of time, but not really, very rarely,
Not
doctor.
really. Okay. Any nausea?
No, doctor.
Okay. Mrs. Leila, other than this, do you have any other health problem like high blood
Uh,
sugar?
no, doctor.
Do you take any regular medicine for any other reason?
Doctor, I'm taking this contraceptive pill and I'm taking this
Mm-hmm.
Brufen for my migraine.
You take Brufen and you take COCP. Okay. May I know, Miss Leila, when was your, I'm going to ask few personal questions. When was your last period?
Doctor, it's been 2 weeks ago.
2 weeks ago. And for how long you're taking this medicine, COCPs?
Doctor, just started a few months back.
Few months back. Okay. And yeah, how about the headache?
Doctor, headache I'm getting with doctor told me this is menstrual migraine, so he given me this
Mm-hmm.
medicine, doctor.
Mm-hmm. And you think that since you started this OCPs, your headache is getting worse?
No, doctor, my headache is not, there is no problem with my headache.
Okay. And what do you do, Miss Leila?
Doctor, I'm a, this beautician.
Okay, nice job. And it's challenging also. How are things at work?
Work as usual, busy, festival seasons are going on.
Okay, so you're working long hours?
Yes, doctor, 12 hours, doctor.
12 hours, challenging job. And Miss Leila, who do you live at home with?
Doctor, I'm living with my, mother and father.
Mm-hmm. And how about you're taking this UCP for contraception, right?
Yes, doctor.
So you're married? Where is your husband?
Doctor,
Or
we
you're
separated actually. So,
okay,
that's the first.
okay. So you have another partner, I believe?
No, doctor.
Then why you're taking this medicine, COCP?
Just doctor, I started, before separation.
Okay.
Yes,
So you
doctor.
started for birth pacing or any other reason?
No, doctor, I was getting this some personal issues, so my gynec started this.
Okay. Okay. And she recommended to take it continuously?
Yes, she mentioned that you have to take it continuously because she told that something in my tummy. She didn't mention me, but she told that there's
Okay.
something in my tummy, so that's the reason she started.
So she didn't start it for the birth pacing, right?
No, 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 it's not for birth control.
Okay. Okay. Okay, Miss Leila, do you smoke
No, doctor.
or take alcohol?
No, doctor.
Any party drugs?
No, doctor.
Miss Leila, how about coffee and caffeine intake?
Doctor, I do take coffee bedtime. I do take
Mm-hmm.
coffee in morning, empty
Okay.
stomach. By middle of the day, I used to take
Mm-hmm.
3 to 4 cups of coffee.
Okay, it seems to be causing you problem, I think so. We'll discuss it in the later. And how about your typical diet? You're eating most of the time at work. What's your typical diet?
Yes, doctor, I'm taking outside mostly because
Mm-hmm.
but I'm
Mm-hmm.
spending 12 hours out of my home.
Yeah, I can see it's very challenging. So, Miss Leila, what do you think? What's going on with you? Any idea?
Look like doctor, maybe my stomach is not healthy. Maybe I got some stomach infection.
Mm-hmm. And what's your utmost worry?
Doctor, I don't want to get some sort of gastric ulcer. I read on Google if
Hmm.
I'm getting this problem, I'll be getting gastric ulcer.
Hopefully not. And how this condition is affecting your life? I mean, this is painful, and
Of
how
course,
you're dealing with.
doctor, I have to, keep on get absent from the work because whole night I can't sleep. So
Oh,
it is
okay. So
affecting me a
sorry.
lot.
Sorry to hear about this, Miss. It must be very difficult for you, Miss Leila. And in what way you want me to help you today, other than
Doctor,
managing your pain?
can you do one tummy scan for me?
Okay, we'll talk on this. Miss Leila, so far you told me that you're suffering for past 3 months with severe burning pain. That's more disturbing at the night time. You also have heartburn, and you try to take some syrup, but it's really affecting your life. You expect to do a tummy scan to find out the
Yes,
reason.
doctor.
That's all.
Yes, doctor.
Okay, Miss Leila, can I examine you?
Yes, what you want to examine, doctor?
Naina, I will, in complete privacy and in the presence of female chaperone, let me take
Mm-hmm.
your vitals and I will check your eyes. Please show me
Mm-hmm.
your eyes. I will check your tongue. And can you please come to the couch and expose your tummy for me if you're comfortable?
Yes,
Okay, I
doctor.
will. Okay, I'm going to look at your abdomen, tummy, and then I will touch it lightly in the center where you're telling you have the pain. If you have pain, please let me know. And then I will
Okay,
touch a
doctor.
little bit deeper on the right side, left side. We'll check for your liver, and then I will check, auscultate with the stent. And if you allow me, I will check from the back passage also.
Okay. Examination normal.
Miss Leila, it looks like that you're suffering because, as you're saying, it doesn't look like at the moment that you are having any stomach ulcer. But we cannot say anything for sure like this. But at the moment, it looks like to me that probably from the food and your lifestyle, the excessive coffee intake, it's causing you trouble, and your stomach is having little inflammation. We call it gastritis. And at the same time, I fear that you also have some symptoms of reflux. Are you getting me?
Okay, okay,
So
doctor.
what happens when I forgot to ask what is your weight, Miss Leila?
Doctor, my BMI is 39, trying to reduce it, doctor.
Okay, okay. So Miss Leila, yes, you're trying. What are you trying to do?
Doctor, I'm trying to skip my diet.
Okay, Miss Leila. So I can help you in that. Skipping your diet is not, maybe this is aggravating your symptoms. So at the moment, I'm going to give you, I'm going to advise some tests for you. Is that okay with you?
Mm-hmm. That's what you do,
Okay,
doctor.
let me do an H. pylori test for you and a CBC and ESR. And I'm going
Mm.
to give you a medicine called Nexium,
H.
esomeprazole
pylori
20
positive.
milligrams. H. pylori is positive. Okay, Miss Leila, you are having, since you are having this symptoms of gastritis, and this test is also positive. So I am recommending you a treatment for 7 days. That will be
Mm-hmm.
amoxil 500 milligram 2 times a day, and
Mm.
clarithromycin 500 milligram 2 times a day, and Flagyl 500 milligram 2 times a day, and Nexium 40 milligram 2 times a day. Are you getting me?
Okay, doctor.
Okay, and in with this, I also recommend that please avoid taking coffee, minimize it, and at least avoid before going to bed.
Okay,
I'm giving
doctor.
you a leaflet to have for the healthy diet, and I'm giving you a diet plan and exercise
Time
plan to
up.
follow.
Time up.
Uh,
Dr. Iram, let me tell you. Now, this is a classical example of what just now I have just a few minutes ago I have mentioned pitfalls of failing in exam.
yes,
You did
doctor.
you did
I got
very
confused
excellent.
with the
Okay, you know
COCT.
what you did?
I
You know what you did?
Yes.
I'll tell you. You did a stethoscope examination with epigastric pain.
Okay. Okay.
This is a clear fail exam. Okay, this is a clear fail scenario in front of an examiner at MRCGP South Asia. Your case was fantastic, fantastic. I should say that you didn't miss anything. But what you did, you
Mm-hmm.
put the stethoscope with simple recent onset of epigastric pain.
So we should not do that for any bowels. Ah, that she was tender. Okay.
This is
Okay.
standard, doctor. Not
Yeah, yeah.
focused
If
on
the patient is
patient
tender,
examination.
okay.
Okay, please be careful.
Mhm.
Okay, this is. I hope that you will
Doctor,
understand what I mean.
we
Yes,
haven't
doctor.
understand what are you saying that
No, actually,
how
doctor, yeah, I understood what he said. Actually, in the examination, when we are performing, if the patient is tender, we don't proceed to the bowel sounds, right?
No, let me tell
I
you,
think
focus
first
examination
we
meaning like say, like I told you, Dr. Iram, I told you that's
Yes,
focus examination. Am I right?
yes, yes, yes.
Okay, now focus examination, why examinations are failing that not focused on the patient examination. The
Okay.
example, classical example, assessing the bowel sound or shifting dullness is not going to be essential in a case
Ah,
focused on recent onset epigastric pain, doctor.
I got it. Yeah, I got it now. Thank you so much.
Okay. Yes,
Yeah, yeah.
doctor.
So, doctor,
Please,
the
And
please
what
be.
is
diagram
the
of
role of
CUCP
CUCP, doctor?
also, right,
we
doctor?
Sorry,
haven't
doctor.
understood that what are you saying. Kindly explain this
Uh,
again.
Smith
We
sir,
haven't idea about that.
Yes,
uh,
doctor. Let me tell you, doctor. I will give few example for every one of you. Why I bought this example because many of our fellow friends, they lost their exam because of simple things. Okay, I
Mm-hmm.
have these protocols from MRCGP South Asia. That on the protocols, as per the protocol, it says the pitfalls for why the candidates fail in the examination. They give in every each and every point that tick point what they are missing. So in the examination scale, not focused on the patient examination means focus examination does not mean superficial examination one, but that which
Mm-hmm.
focuses on eliciting finding that will help to confirm or refute a possible diagnosis. Okay, you got my
Okay,
point.
I got it.
Now,
Mhm.
okay, this usually include the relevant elements of general examination and some system specific examination tailored to nature of the patient complaint. Again, Dr. Iram had this patient having in epigastric pain, not abdominal pain. Okay, now she put the stethoscope to see her abdomen. Here, doctor, we have to see that assessing the bowel sound or shifting dullness is not going to be essential in a case of focused on recent onset of epigastric pain, doctor.
Yes, I got it.
Yes, doctor.
Hmm.
So,
Okay.
yeah, what happened here? She did a fantastic. There was no loophole. There was no gap. She did. I must say that was 100 by 100. But it is same like have you ever played that snake and ladder game? Okay, when
Yes.
you're reaching on the snake will bite you suddenly down. So same thing happened with Doctor. I'm sorry, Doctor. So
Dr. Imran, so in this case, only superficial and deep palpation was enough.
yes, doctor.
Mhm. Doctor, I have one more
Okay.
question. I got confused with the COCP. What was that? I mean, should I stop it or continue it?
Yeah,
Because my time finished
yeah,
also.
doctor, that was the agenda to know about patient having migraine and why patient taking COCP.
Yes, this is what I wanted to explore, and it took
Yeah,
extra minutes, and I couldn't finish.
doctor, this is a mixed scenario. Let me tell you, this scenario come in a both way. One scenario will come in a contraceptive method that one of the doctor we might get this case as a contraceptive. Okay,
Okay.
contraception. Okay. Contraindication. One doctor might get is a GERD with dyspepsia, and one person can get as a peptic ulcer. There are three scenarios from one scenario arises. Okay. For your scenario was a GERD with dyspepsia. You gone very well, doctor. But now here,
Doctor, if I was able to finish, I
Doctor,
must have
GERD and what
discontinued
kind
the
of illness?
COCP.
sorry, doctor.
The
GERD and
COCP
what
had to
kind
be
of illness?
discontinued. Let me finish, please.
Yes, Dr.
Uh,
Adam. Dr. Adam. Yeah.
I want to just clarify because I couldn't finish the case. I want to say know that do I have to change the COCP? She was not telling me the
Yes.
clear reason.
Yes, doctor. You have to change or you have to send back to the specialist. Either one.
Okay. Okay.
Okay, now
Okay.
Dr.
I got
Saira,
it.
you up to
Thank
you,
you.
doctor.
So, doctor, I was just asking this GERD, we say gastritis because antibiotic also we started.
Doctor, patient
Gastritis.
having, patient having two symptoms are there. And this the case was discussed last yesterday also. And there was one case discussed before Dr. Mavish with Dr. Mavish, and the same case was there, but different scenario. In that
Doctor,
scenario,
I was
patient,
there. That was like upper GI bleeding.
yes, doctor. No, not this, not upper GI bleeding. The initial days when we were doing the practice, okay?
Oh, okay.
Yeah. So that patient had only symptoms up till his epigastrium. If
Yes.
patient stomach is involved, we will be calling it dyspepsia with GERD. You getting my
Okay.
point? But if
Yes,
patient
yes.
having only epigastric symptom, there is no abdominal symptom like here, stomach upset or bloating, we will not call as a dyspepsia. We are not going to order any H. pylori. Okay. But if patient's stomach is involved with epigastric burning, then you are going to start only stomach involvement, then you are going to do the H. pylori and the treatment.
Okay, doctor. But stomach
So in
involved, like
this case,
how
H.
do we
pylori
say?
was positive. That's why triple therapy has been given.
Yes, doctor. Yes,
Yes,
doctor.
yes, yes. So, doctor,
Okay.
like how to differentiate stomach was involved and from the symptoms of the patient?
Yes, doctor. Patient will tell,
Okay.
okay, are you getting this pain in the stomach or only chest? Doctor, I'm getting
Oh,
this pain only in the chest. Okay, it means
hmm,
stomach is not involved. Okay.
hmm.
Is patient will say, doctor, my stomach also hurt, my tummy also hurt, my chest also burning. So it is a both involvement. Okay, it comes
So
as a
you can say
dyspepsia.
Doctor,
dyspepsia.
in this case,
Okay.
this was stool antigen H. pylori was positive or on
Yes, to
endoscopy there was.
stool endoscopy GP will know to doctor.
Yeah. Okay. I
Mhm.
was thinking maybe doctor will say gastritis. That's why diagnosis was. Okay, doctor.
Okay, Dr. Saira, your case is there with me. Dr. Iram, if you still having question and query, please let me know because this is the classical scenario of the person, those person, they having the query that, doctor, I did a wonderful examination on wonderful case, but why I got the, I didn't pass through. So this is a wonderful example.
Thank you so much, doctor, for
Okay,
correcting. I
doctor.
will never forget. Thank you. Sir,
Okay, Dr. Saira. Yes, Dr. Sangeeta.
yeah, sir, you asked her do ultrasound. So what happened about the ultrasound?
Ultrasound pending, doctor.
Okay, okay.
Yes, doctor. Okay, Dr. Saira, your
Yes, doctor.
patient is ready for you. He is Mrs. Nadia, 27 years old female, come to discuss her some problems been months going on. She's a bit disturbed and she wanted to get rid of this thing. Okay, take proper history, management, and examination.
Okay.
Okay, yes, doctor. Okay, start.
Good morning, Miss Nadia. I'm Dr. Sarah here. How can I help you?
Well, doctor, I have crampy pain in my lower tummy. All on both sides of my tummy, doctor, really hurts.
Okay, all right, Miss Nadia. Can you tell me more about your pain?
Doctor, mostly I'm getting this pain before going to the toilet. Sometimes get relief after passing the motions, doctor.
Okay, all right. May I know what type of pain it is?
Doctor, it's like say crampy pain. I feel that there is a cramps in my tummy.
Okay, so it's lower tummy as you mentioned.
Yes,
Okay,
doctor.
right. So may I know the like what does it go anywhere else?
No, doctor, this is only my tummy, lower
Hmm.
tummy.
Okay. Does anything make worse your tummy pain?
Well, doctor, what's before opening the bowel, I'm telling you.
Hmm. Okay, then once you pass this tool, you feel better.
Yes,
Okay.
and sometime when
All
I'm
right.
eating the pasta and bread, but also after when I'm stressed also.
I can understand. If I want to give you a score 1 to 10, 1 is the least, 10 is the highest, what number you want to give?
Okay, it's like say discomfort only. I will say two or three, maybe four.
Okay. May I know how many times you are going passing stool?
Doctor, that is a really big long story, but let me tell you in the short, doctor. Sometimes I'm getting loose motion. Sometimes I have to run for constipation. I have to cry to pass motions. And on my bad days, doctor, I have to pass 4 to 5 motions with urgency. I can't hold, doctor.
I'm so
And I
sorry
feel
to.
annoyed in the public, doctor.
Okay, all right. Is this like stool is difficult to flush?
Yes, doctor. Sometimes mucus is there that I feel that some jelly kind of thing.
Okay, okay, all right. Any rashes on the body?
And no, doctor.
Any weight gain? Any change in your
No,
body weight?
no, doctor. My weight is always like this.
Do you feel cold when others are feeling hot?
Normal, doctor.
Okay. Do you smoke?
No, doctor.
Miss Nadia, any long-standing disease you have?
No, doctor.
Any regular medication?
No, doctor. I was having this. Can I share with you, doctor?
Sure, Miss Nadia.
Are you sure, doctor? You will not share with anyone?
Miss Nadia, we are seeing everyday patients, and whatever you are telling me, it will be confidential between you and me. Don't worry. It's
Doctor,
between all of us.
I am having depression and anxiety. Doctor started me
Mm-hmm.
medication SSRI. Only my mother knows, doctor. So no one knows
Okay.
about it. Okay.
Okay, Miss Nadia, it will be as your privacy, it will be confidential. So, which medication are you taking?
Doctor, this is SSRI.
Okay, since how long?
Doctor, it's been 2 years, doctor.
Mm-hmm. Okay, and now the anxiety or depression is like feeling better.
Doctor, it's somewhat same, doctor.
Same. Okay, okay, right. We'll discuss this particular issue too. Okay, and may I know, do you drink alcohol?
No, doctor.
How about your daily diet?
Doctor, I don't like to eat because I'm scared to where I will be passing the motion. Some food causing me constipation, so it's really hard for me to eat, doctor.
Okay, did you check your body weight lately?
Yes, doctor. My BMI is 26.
Mm-hmm. Okay, okay. When your last period date?
Doctor, my period 3 weeks ago, doctor.
Okay, may I know what do you do for a living, Miss Nadia?
Doctor, I'm a project manager.
Mm-hmm. Okay, how are the things at work?
Oh, doctor, really stressful job. I can't hold on that one, doctor.
Yes, I can see might be very difficult because more responsibilities. Miss Nadia, with whom do you live?
I'm living with my mother, doctor.
Mm-hmm. Okay, okay, okay. May I know what do you think about this pain?
Doctor, as I think that my mother, I'm having this like IBS.
Okay. Oh, sorry, your mother, how she is now with IBS?
Doc, doctor, she's on the medications.
Mm-hmm. Okay. Miss Nadia, may I ask, are you sexually active?
And yes, doctor.
Okay. Are you using any birth control pills? A method?
Doctor, I'm taking these contraceptives.
Mm-hmm. Since how long?
Um, since my university life, since
Since a university life. Okay. Okay. In between, have you consulted any doctor for the medicine?
no, doctor. This been ages now. I haven't seen a
Okay.
doctor.
Okay. Right. We'll discuss also this particular issue. Miss Nadia, what's concerning you more?
Doctor, I'm scared that it might be something serious like Crohn's or cancer. I have reading on the Google that this kind of symptoms can be Crohn's disease, which is a little bit more scary for me, doctor.
Yes, I can understand. Okay, I hope so. It will not be like that. Okay, I can understand your valid concern. And what do you expect from me?
Doctor, just do something for me, doctor.
Mm-hmm. Surely, I'll do my best to help you. And how does it impact on daily life?
Doctor, I can't go. I'm avoiding social parties because of my stomach problem.
I'm so sorry to know about your stomach problem. Miss Nadia, can I sum up now for you? You have this pain on and off in your lower tummy, and as you notice, it's getting relief after passing a stool, and your concern might be some cancer or some serious condition. You want from me to some medication to relieve this pain. Is this all, Miss Nadia?
That's all, doctor.
Thank you so much. Can I examine now?
Go ahead, doctor.
Okay, I will sanitize my hand with the alcohol. I will check your pulse. I will look at your hand first, skin, dryness, and check your pulse. And I will check your nails also there, elbows. And can I see your eyes? Please look down, up, oral cavity. Thank you so much. Can I check your lumps and bumps in the neck? I will touch. Okay, thank you. Can you, Miss Nadia, please lie down, unbutton your shirt with the proper privacy of chevron?
Hmm.
Are you comfortable? Okay.
Yes, doctor.
I will look for your tummy and anywhere pain I will touch and feel and listen your tummy. Anywhere pain, please let me know. I'll start from right side to left side, slightly first, then little deeper. Okay. I will check the even feet also for the skin. I will
Examination
listen
normal.
the abdominal sound. Okay. Okay. Right. Okay. So I want to do some investigation. Is it okay with you, Miss?
Yes, doctor.
Okay, I will do CBC vitamins. I will check serum ferrous and the vitamin B12 and celiac antibodies and fecal calprotectin.
Okay, fecal calprotectin, normal.
Mm-hmm. Okay. Okay. Whatever from the history and examination, Ms. Nanda, I'm suspecting you have condition called celiac disease. Actually, is an autoimmune condition when our body own defense system is attacking our intestinal cells. Are you getting me, Ms. Nadia?
Okay, doctor.
There's a reason we are not getting absorption of our food.
Mm-hmm.
Okay. So, first of all, Ms. Nadia, it's a quite nothing to worry about this. If you are thinking there's some serious conditions, quite manageable condition, not any cancer for your clearance. And as you were thinking about IBS, also like your mom, it's not IBS. Am I clear, Ms. Nadia?
So what kind of the sign will be in IBS, doctor? What will happen in IBS if I am having IBS? So I should know of that.
Yes, that's what I'm saying. I have to confirm after reports will come. Okay, I'm suspecting. That's why I mentioned. Is
Mm-hmm.
it okay, Ms. Nadia? Once a report will
Okay.
come, we will confirm our diagnosis. And for further
Mm-hmm.
diagnosis confirmation, I'm referring you to the specialist. They will do some through the camera. They will insert some tube and they will take the biopsy. Is it
Okay,
okay
doctor.
with you?
Okay,
Okay,
doctor.
and for most probably the autoimmune antibodies, whatever they are against mostly the food you are taking, like the pasta and potatoes, as you mentioned already. In this
Mm-hmm.
condition, wheat, barley, oats, these are the
Mm-hmm.
main cause. Once you are eating the food, this is why that they are not getting properly absorption.
Okay, doctor.
Okay, so
Mm-hmm.
once our diagnosis is getting confirmed, then
Mm-hmm.
I will refer you dietitian. We have a structured dietary plan. You will follow
Mm-hmm.
that one. Even I will give you leaflet about that. So, and one more thing, you will make the even diary for your food. What food are triggering? Is this okay with you?
Mm-hmm. Okay,
Okay.
doctor.
Other than this, Miss Nadia, I'm literally concerned about the stress and depression. If you can book another session so we can discuss about your depression also, is it okay with you?
Okay, doctor.
Okay, and increase intake of water and the lifestyle, like try to do exercise. It will help you like to reduce like make your stress down and do it.
Time up. Okay, Dr. Sarah, I have one question. What were the
Yes.
investigation recommended for this case?
Celiac antibodies I was suspecting.
Then what else, doctor? You did vitamins also?
I was thinking maybe because of the vitamin deficiency, when there's
Okay.
celiac
Okay.
deficiencies
Doctor,
are
was
getting.
it IBS or it was celiac? I think it was IBS, no?
It is IBD. Oh, so IBS,
IBS.
sorry. IBS, yes. Okay. And
Not
now one of
IB,
the,
not celiac, doctor.
no, it's not celiac, okay. Okay, now let me tell you one more thing, doctor. Again, the
Like your doctor.
pitfalls of pills. Okay, I'll talk on doctor. Doctor, I'll come on to that one. But let me tell you here why I asked you about exam investigations. Pitfalls of failing exam, uh, management and skills and investigation, inappropriate investigation. Some candidates over investigate rather than performing those investigations that would help or exclude a diagnosis. A normal practice, the diagnosis is clear on first encounter in some cases and not in others. Some cases require candidate to develop a differential diagnosis through investigation or a treatment rule in or out the leading diagnostic problem. So, Dr. Saira, here you did vitamin test.
Yes, doctor. Yes.
Okay, please be careful. Okay, because
Mm-hmm.
telling many investigations doesn't going to pass us. It might fail us. Please be careful.
Okay,
Okay,
doctor.
now let's see talk about Dr. Rubina was talking about this one. So this was the case of intermittent abdominal pain and altered bowel habits. Okay, patient don't have a night symptom but having only problem in the morning time. She have to difficulty in opening the bowel, and after that she's feel relief. Sometimes she's getting constipation, sometimes getting loose motion. So her mother having IBS. So how are you going to explain? Okay, this is IBS. Positive diagnosis. Explain this. IBS is a now again, Dr. Saira, I have noticed one thing that you are telling the patient, don't worry. This is encountered as a wrong hope. So you should tell that Mrs. Nadia, from your history and examination, what I got it. This is IBS, which is a treatable. But the good news is this is a treatable. You should not give the wrong hope. Sorry, today I'm going in a little bit deep because I have found few things. Then I wanted to clear from my side to, as per the protocol of MRCGP, not from my side,
Yes,
doctor.
doctor.
To yes, doctor. So you should not give the wrong hope. You should not say don't worry. And if you're saying don't worry, it will give you a negative impact that you're giving wrong hope. Okay, this is a case of IBS, doctor. Patient having the history of presenting illness was having alternating bowel habits, sometimes 4 to 5 motions with urgency, sometimes constipation, no nocturnal diarrhea. She didn't ask, mucus was present, but there was no blood. There was no sticky, but mucus was there, doctor. There was no fever, no significant weight loss. Appetite was preserved, some bloating and nausea after meals sometime, but not all the time. Trigger factor, some seems worse with pasta and bread, but also when I'm stressed. Celiac will not come with stress, no, doctor?
Yes, doctor.
Okay.
Yes.
Yes,
Yes,
doctor.
got it.
And patient celiac antibody was negative. Sorry.
Hmm.
So this is
And
IBS,
Dr.
doctor.
Imran,
Yes,
so
doctor.
Dr. Imran, in this case, all steps of abdominal examination were to be followed, including
Yeah,
the
doctor. She's
auscultation
having
of the
she's having she's
stomach.
having lower tummy examination, so she have to follow.
Okay.
Yes, doctor. But only when there is epigastric involvement, for example, it is there. So it's a new onset. She's been suffering since ages. Okay. So
Right.
you have to, yeah, so you have to see in a way.
One thing I may want to add, if, for
Yeah, doctor.
example, if a lady, for example, if a female above the age of 50 presents with these kind of symptoms,
Yeah.
we shall actually request CA125 to rule
Hmm.
out any ovarian cancer. It's a guidelines. I mean, any
Yes, true.
patients. Yeah. So any
True.
patient, if, yeah, yeah. That's just I wanted to add. Thank you. Thank you.
No, that is wonderful. That is actually an exceptional point you added. Thank you, Dr. Shahid. And moreover, again, you told this thing that I just want to refresh everyone memory because I'm keep on telling some red flags are that we should remember. Age more than 60, female with pervaginal bleeding, male with any weight loss history or some sort of chronic problem. This is a red flag. So you have to send the patient immediately. So you should not keep the patient. You are going to refer the patient immediately. Okay. So referral also, doctor having managing the referral also having the negative points. Okay.
Okay, doctor.
Yeah. So doctor, I think one doctor is pending with me, and after that we'll be taking off. Um,
Dr. Mel.
Yeah, Dr. Nimra. Yeah, Dr. Nimra. Dr. Nimra, I think second or first is there. Okay. Dr. Nimra, your case
Yes.
is 30 years old Mr. Khalid. Come to discuss his problem with you. Take proper history and manage the patient. One of the most commonest scenario in the exam. Again, why I'm talking most exam, commonest exam scenario? Because this is most commonly tested on GP and South Asia exams, doctor. Okay, doctor.
Okay, start.
Give me one sec, doctor. Okay, doctor, start.
Mushi.
Start.
Hello, good day. My name is Dr. Nimra. I'm your GP today. How can I help you, Mr. Khalid?
Doctor, I'm having this loose motions. Every day I'm going to toilet 5 to 6 times. And I have abdominal pain. I feel nausea. I feel feverish, doctor. I don't know what's going on with me, doctor. I don't know. These days it's really hard for me to tolerate, doctor.
Okay, so sorry to hear about this, Mr. Khalid, about your problem. Can you tell me something more about your condition?
Well, doctor, I am having this problem since, I told you that this is third day going on, and it's not leaving me, one minute also. I have to rush to the toilet. I have to sit in front of the toilet for a while. I don't know what to do, doctor. Can you tell me what's going on with me?
Okay, I'm here to help you, Mr. Khalid. May I ask you a few questions about your problem?
Yes,
Okay.
doctor.
Okay, please tell me from how long do you have this loose motion?
Doctor, I told you this is third day.
Yes. Sorry, I forget it. And is it progressively worsening now?
Yeah, doctor, it's been every day 5 to 6. Initially, it was just one or two stores. Now it's been 5 to 6 now.
Okay, okay. Okay, and you do also have the fever, and is it high grade or low grade? Have
Doctor,
you
I'm
by
having
added by thermometer?
low grade fever. I feel feverish, doctor.
Okay, and anytime you feel dizzy?
No, doctor.
Okay. Anyone else in your home having the same problem of loose motion?
Well, doctor, I'm living in university. I came back from my country actually.
Okay, okay, okay. From when you come back from your country?
Doctor, I'm from Pakistan. I've just came back from my country 5 days ago. I was there for 2 weeks.
Okay, okay, okay. And anything you eat from outside?
Of course, doctor, that's my place. I ate a lot of street food over there several times, and that's my place.
Yes,
I
yes.
went to refresh my memories.
Mm-hmm. Okay, okay. And what about your pain? Can you tell me where exactly you have the pain?
Doctor, it's crampy pain all over my tummy.
Okay, and is it relieved by when you pass the stool?
Doctor, I feel comfortable after passing the motion.
Okay, okay. And do you have any flatulence also?
No, doctor.
Okay. Have you noticed any blood in your stool?
No, doctor.
Okay. Are you feeling any nausea?
I feel nausea, doctor.
Yes. Any vomiting?
No, doctor.
Okay. Okay, Mr. Khalid, please tell me. You told me already that you are living in the university hostel and with your roommates. So are you doing any smoking?
No, doctor.
Okay. What is crossing your mind? What it can be?
Doctor, I think my tummy got some bad infection.
Yes. And please tell me what is your main worry today?
Doctor, I think I just wanted to. I'm just worried about maybe I will be getting some sort of hole in my tummy.
Okay. And what do you expect from me? How can I help you, Mr. Khalid?
Doctor, can you give me some antibiotics?
Okay, I'm here to help you. Okay, please tell me, you have this diarrhea from the last 3 days and how this has impacted you.
Doctor, I have exam day after tomorrow, so
Yes.
I haven't prepared myself.
Okay, yes, it's very disturbing and for you that you have the exams and you are suffering from this condition. Yes, I can understand. Okay, Mr. Khalid, let me summarize you that you have told me so far that you have this loose motion and abdominal pain from the last 3 days. You have visited your home country 5 days ago. Okay, for 5 days, 2 weeks ago.
Mm.
Okay, and you think that it is something infection in your abdomen, and you want me to help you. You will need some antibiotics. Anything else you want to add in it?
Nothing, doctor. That's it, doctor.
Okay, may I examine you, Mr. Khalid, in the presence of
Yes,
privacy?
yes, doctor.
Yes, I will check your pulses. I will check first. I will sterilize my hand and check your hands for any sweating and then palpate your pulse and your I will take your blood pressure, temperature, respiratory rate, oxygen saturation. Then I will look for any pallor or jaundice in your eyes, and please open your mouth and protrude your tongue. And then I will palpate your tummy superficially and deeply. and I will do that skin pinch test for any checking dehydration. Okay, and that's all. Okay,
Anything else, doctor?
I will. Yes, that's all. I also want to check your weight according to
That's
your
it,
height.
doctor? Anything else, doctor?
Yes, that's. I will palpate your tummy and I will palpate your liver also.
Anything else,
That's
doctor?
it.
Okay.
Nothing else. Okay.
Okay, mildly dehydrated, heart rate is 120, abdomen soft, mildly tender, no gardening, digital rectal examination, normal.
Yes. Okay. So I forgot it. Okay, Mr. Khalid, from your history and examination, I also want to run some of the investigations. Is that okay with you?
Okay, doctor, what you want to do?
Okay, I want to check your full blood count and I want to check your stool test. Okay,
Okay, what else, doctor?
and that's all. Okay, and it seems to me from the history that it looks like traveler's diarrhea. Do you know anything about it, Mr. Khalid?
And doctor, I don't know what's going on with me, doctor. Okay, doctor, tell me. Hello? Am I audible to you guys? Dr. Nimra?
Yes, doctor, you are the
Okay, doctor. Think she got disconnection.
Hello, hello, hello,
Yes, doctor. Yes, yes, doctor. Okay, doctor,
hello.
can you tell me? Yeah,
Okay.
doctor, start.
Yes, because you have visited your home country, and it's most probably that you are suffering from traveler's diarrhea. So it's better that we will give
How
you
this happened, doctor?
some. Yes, because you eat from the outside and street foods, and in most cases, it is the reason when we are not taking hygienic food and we are not following some protocols like washing our hands and all that things. Okay,
So, doctor, you
Mr.
giving
Khalid, are
any
you getting my
medicine?
point? Yes, I'm giving you tablet loperamide 120 milligram twice a day for 5 days. Okay, Mr. Khalid, and it will relieve your abdominal pain as well as control your diarrhea. And I'm giving you this ORS sachet. You can use make a 1 liter ORS and take 1 cup after passing stool, or you can use as much as you can. Okay, Mr.
Okay,
Khalid, it
doctor.
can
Okay,
also
okay, doctor.
improve your hydration. And
Okay,
please
doctor.
you use this bread diet like this apple sauce, rice, banana, and toast, and avoid
Okay, okay.
anything from outside. It's better
Okay,
that you will ask the chef to make it with proper hygiene for you if you can. Okay,
okay,
Mr.
doctor. Okay, doctor.
Okay, or if you have some friends in this country, you can take the help from that, and maintain a proper hygiene. Wash your hands before
Hmm.
eating. Okay, Mr.
Okay,
Khalid, are
doctor.
you getting my point? Yes.
Okay,
Anything
doctor.
else you want to know?
No,
And
doctor,
if your
that's it,
diarrhea
doctor.
is not improved in 2 days, please come back to me. Okay.
So, you
And if
giving
you
any
feel
antibiotic,
any
doctor?
dizziness, no, I'm not giving you antibiotics right now. Okay, Mr.
Okay,
Khalid.
doctor. Oh, okay, doctor.
Okay. Okay. And if
Okay,
you feel dizzy or dehydrated, please come in the emergency. Okay.
okay, doctor.
Thank you.
Thank you, doctor. Dr. Nimra, first of all, let's have a talk on examination part. DRE, if you're not doing your whole examination part will finish. There is no marking because the examiner will not give you the finding. Okay, examiner will tell you examination not normal or he will be keep calm. Okay, so it means you will be considering something is if anything abnormal also Any abdominal examination, you tell that I will be finishing my examination by checking your lumps and bumps in your inguinal area with digital rectal examination. That's it. And thank you very much. You have to see it. Okay. And the second thing, patient having fever. So you have to use the loperamide. You cannot use when patient having fever and patient having blood in the stool.
Mm-hmm.
Yes. Okay. Otherwise,
Actually,
fine.
I
So
didn't heard the PR examination. So I can't hear there was some interruption, so I can't hear the PR examination. There was some blood in the stool.
no. Empty. Normal.
Okay.
Okay, so doctor, we have one celiac disease case, ulcerative colitis flare variant case, and one, two. Then I have amoebic dysentery, hepatitis A, hepatitis A and E and B and C, and deranged LFTs and non-alcoholic fatty liver disease. Let me tell you the doctors, few doctors I have to. Doctor, you don't have to do DRE. You have to tell the patient I'm going to finishing a DRE because abdominal examination to finish up with a DRE, Doctor Wasim. We don't have to
Okay.
do the DRE.
Okay.
Yeah, doctor.
Okay. I
So,
want to
doctor,
ask you: is it traveler's diarrhea or IBD?
travels diarrhea. You correct. You correct. Your diagnosis was correct. Okay, Doctor Sadaf, Doctor Jaya, Doctor Sangeeta, Doctor
If you ask
Nadia. Sorry, doctor, give me 1 minute after I'll be listening to you guys. Okay, Dr. Jaya, Dr. Sangeeta, Dr. Nadia, and Dr. Sadaf, and Dr. Rida, Dr. Rubina, and Dr. Amna. And Dr. I will be taking your session in evening today. I'll be giving you time. Maybe I have one meeting labs is here, so maybe I will be arranging tonight one more session extra. Okay. So if you guys are available, please make sure your availability because you guys are going for exam earlier than others.
So, doctor, there will be same examination. Will I get chance for examination 2 minutes?
Examination tournament? No, today, doctor, I have today I am doing that remaining topics of chronic hepatitis. Sorry, chronic hepatitis B, C, hepatitis A and E, and this ulcerative colitis flare, and this 4, 5 topics are there. So I have 7 cases with me. So 7 doctors I'll be picking up tonight. So I'll be
Okay,
finishing within sorry, not 7 doctors. I'll be taking 5 doctors. Sorry, 5 doctors, 5 scenarios I'll be taking. Okay, so I'll be finishing up. So tomorrow we will be having morning and just afternoon session only with revision and followed by evening session only for 1 hour for examination. Tomorrow examination will be abdominal examination. Okay.
okay, okay.
Yeah, Dr. Iram, what you
Dr.
want to
Imran,
say?
please tell. Dr. Imran, please tell me: is an antibiotic needed in this case?
Doctor, it was not needed. Okay, it is needed only when there is a
Mhm.
clear cut in some that what you call it indication is there. Okay, so in this case, like say in traveler's diarrhea, there are few things to remember. There is no long management plan, but you have to talk more on patient sanitization and tell the patient to do hand wash technique and separate the things
Mhm.
because to protect anything. Okay, so since you are suspecting this one, it's not a confirmed diagnosis. Am I right? So in that way, you have to tell this patient, you have to hydrate yourself. In case high grade fever you're getting, I will be giving the paracetamol tablet. Okay, already hydration salt, simple diet, and avoid anti-motility drug agents like say as you given uh, loperamide. If patient having blood or fever you cannot give, but if there is nothing such thing, then you can give with cautions. Okay, and you have to tell the patient cautious and use self-limiting because you have to tell this is usually self-limiting. Okay, you can give empirical antibiotic only if there is a severe or high risk cases like say chronic diabetic or some other patients are there, immunocompromised patients are there, we can do it. Okay, and for diarrhea, any kind of diarrhea, please one more thing you have to add on where you traveled. If for the layer, so any other like say what you call sexual activity, you have to ask. Sorry for the okay, you have to ask. I forgot to mention before. So you have to ask about sexual history because of HIV.
Okay.
Doctor, I just want to clarify one thing. Dr. Nimra sent the stool for the examination. If she's
Yes.
not getting any result from the examiner or no report is there, So she should
Yeah.
say something comes
Okay.
back in the stool, I might give
Y-
antibiotic later or not.
Yeah. No, not antibiotic. She can say that once your report will come back, we will be discussing if it anything needed, we will add on or we will modify it.
Okay. Okay.
Specifically, doctor, when you are doing new TB cases or new infectious disease case, you have to make sure you have to use this word once your reports will come back. Like so, you're sending the culture report. Culture report will not be mentioned by the examiner because it takes time. So examiner want to know whether without anything you are going to be judgmental and you are going to start initiate a treatment. So that will be a negative impact. No. So this is the agenda of that. To hold on some investigation. So how you are going to deal it? So you have to add one sentence that on the basis of your remaining investigation, we will be deciding later. You have to come back after 2 days or once your report come back.
Okay. Thank you.
Okay, doctor. Thank you very much. So, doctors, I mentioned the names. Please be attentive. I will be sending the time, inshallah, by within 1 or 2 hours. I have to see my schedule first. Okay. Thank you very much, doctors. And doctor, those I have mentioned few critical points. Don't get disheartened on this one because that was actually it was meant for in a purpose to make you guys aware that we do something 100%, but we might not pass through because of our something which is more critical and more crucial in that area, and we miss that one. Okay, doctor.
Yes,
Thank you
Dr.
very much.
Imran,
Yes, doctor.
sorry, I couldn't attend that session about IBS. And do we have to run some tests or no? It's just a medical
Yes,
diagnosis.
doctor, you have to run few investigations. Okay, I'll tell you that investigations for IBS, you should not, go with a many investigation plan. So just you can go with that. Let me tell you, give the list of that one. Okay, full blood count,
CBC, all right.
CRP or ESR.
All
Okay,
right.
serology, like say this one, and
Okay.
stool calprotectin, and that's it. And you can stool sample. That's all.
Okay, so you want to rule out celiac and IBD.
Yes, doctor. That's it, doctor.
But if he
This
was
one,
very typical, like you said, don't exhaust the resources, still we
yes,
have to
doctor.
run these tests or no?
No, doctor, these are the 4 tests are mandatory to rule out, okay, to go for
Mandatory.
differential. But vitamins, if you're adding on, that will be overutilization
Of
of the
course.
resources. Yes.
Sure.
Yes, doctor.
All right.
Okay.
And
Thank you very
in
much.
case of, all
Yes,
right.
doctor.
Okay.
Yes,
Thank you.
doctor. Please.
What was that point about the examination? You said this epigastric tenderness and palpation. Could
Okay,
you
let
please
me tell
just
you.
quickly repeat?
Yeah, let me tell you. For example, it was a focus examination. Patient was a history of few days of epigastric tenderness.
Okay.
But
All
I'm
right.
going to listen the patient bowel sounds or dullness. Okay,
Okay.
it will be mentioned as a negative impact, and
Okay.
this is we call it easy to fail the
Mhm.
scenario.
Okay. All
Okay,
right.
so examiner will not give you the marks. Examiner will fail you.
So in history, for
Because
example, if you
you are
ask a
not
patient,
focused. You
sorry.
are not focused. You are
Sure.
just doing the checklist only, doctor.
Okay, so
Yes, doctor.
yeah, I'm asking the same question. So if in history there was no tummy pain, abdominal pain, so you don't have to examine abdomen, right? It was focused on epigastric pain.
Yes, doctor. So epigastric pain, just we are going to palpate and come out.
So
Okay,
if
and
he
you
was
have
tender,
to.
do we still palpate? Do we ask the patient whether it's painful or no?
Yes, you have to palpate only the area of epigastric area and right upper quadrant. Okay.
All right. Okay.
Yeah. And
Thank
moreover,
you. Thank you,
doctor, if
Dr.
patient
Imran.
come with the chest pain,
Okay.
auscultate the chest also, please. Thank you.
Sure. Thank you. Thank you, Jazakallah.
Thank you, doctor.
Appreciate
Thank you.
it.
Assalamu
Bye
alaikum.
bye.
Thank you.